Thank you, Mr. Chairman, and I want to thank our panelists for great testimony. I can't recall a time that we have everybody at a table and nobody here is a climate denier. That climate disruption and climate change is real. That is historic in so many ways, and glad to see that we have that focus. I share the concern that some of my colleagues have about the taxpayer who's paying for this. And I want to suggest, what does it cost the taxpayer in terms of, and again, I'm happy to see that everybody believes that decarbonization has to take place. Am I right about that? I think that there is unanimity there. So what is the cost of carbon on the taxpayer? What is the cost of the asthma, the air they breathe, and the pollutants and the plastics that Ms. Sherman talked about? What is the cost to the taxpayer there? Ms. Sherman?
It's actually Dr. Sherman.
Dr. Sherman, I'm awfully sorry.
Well, the social price of carbon currently, the rate in the U.S., I believe, is around $41, which is considered far too low. The present rate should be around, on average, $185 per ton of carbon. We know that mitigating emissions is good for business. 90% of large publicly traded corporations are already disclosing their carbon emissions, mitigating their risks, and they're doing it because it's good for business. And so healthcare organizations need to do the same thing. This problem is only going to get worse. We are already spending $800 million a year on pollution-related disease related to air pollution and climate change. It's only going to get worse. Healthcare pollution causes harm on the same order of magnitude as medical errors. And preventing healthcare pollution is something that needs to be considered. It's presently an externality. We don't know how much healthcare pollution costs, but we certainly need to understand it more. But bottom line is mitigating healthcare pollution is our mission, part of our mission to do no harm, and it will certainly save money in the long term.
Oftentimes in Congress, however, if we don't spell it out specifically, but those costs are borne by whom, Dr. Sherman? Aren't the taxpayers ultimately paying?
They are 100% borne by taxpayers and also individuals who are uninsured and underinsured and have to pay out of pocket. So every single one of us bears the cost.
And what about the small businesses as well that Mr. Thompson so eloquently talked about in his district?
Well, businesses that have to pay for insurance for their employees, that's going to get more expensive as well, too. People who are out of work are going to lose income because of their disabilities and disease. And so every single one and every business owner is also affected by the cost of inaction, the cost of pollution. Dr.
Bittinger, would you agree with that?
I would, and I think there's a math that actually can be very favorable here as well. That in my own system, we built a new building, Spalding Rehabilitation Hospital, about a decade ago, and built it to be resilient and decrease energy costs. And those factors which improve the resilience, the ability of that hospital not to evacuate during a severe storm, as well as to use 30% less energy, increased the cost of the building by about 0.3%, but has clearly paid for itself and then well beyond with the overall decrease in energy usage and savings. So no cost in that sense, decreasing healthcare costs and increasing resilience.
Dr. Katari?
Yes, thank you. And certainly thank you for mentioning the hardworking Americans, people who are experiencing disparities in health and challenges deciding between food and having paying their electric bill or gas bill. Those are our patients. We are in the trenches. This is our community. When you talk about that, I can tell you we're in those apartments, in those places with them, and the cost is borne by them. When we think about the impact of not doing what we need to do, people are suffering, but people want to live good, healthy lives, and they're recognizing that whatever is happening now is not working. And so the cost is borne by those who have the least to give.
Thank you. My time is up.